validation of a home blood pressure measuring device. Now this is something that one always is faced with when one purchases such a device, and it's extremely important. Now I know you must be thinking, what exactly does it mean? In very simple terms, all that it means is if your device is validated, it means that if it gives you a particular reading, then that reading is accurate, which means that is your blood pressure. Whereas if your instrument is not validated, then you can only imagine it may not give you the right measurement, and then obviously hypertension management can go awry, because everything depends on the right measurement. Now, how is this validation done? Well, obviously this device will be compared to a gold standard with which you measure blood pressure, and only if it matches what that gold standard instrument gives you, then we consider this to be validated. Of course, it is a kind of a trial, there are patients involved, and after doing rigorous studies, and that too, when we talk of validation, it is not just validation in a person who has hypertension. You need to validate if that patient doesn't have only hypertension, but he's also a diabetic, or he may have kidney disease, he may be an elderly person, he may be obese or overweight. So what you'll understand is that it's not enough to say that my device is validated to measure blood pressure. It needs to be validated in all these other conditions that I've spoken of, and the more validated it is, the better. So when you're purchasing a home blood pressure measuring device, please find out how many conditions is this device validated, because that will ensure that, one is, of course, it will be useful for you, but it will be also useful for other members in your family and other people in your circle of friends who come to visit you. So it's extremely important that you have the right device which is validated, calibrated, so accurate, because entire measurement of blood pressure will determine how your management is accurate.